When it comes to healthcare, most of us believe one of two things. If healthcare is more expensive, it must be higher quality care. Or most healthcare costs are the same regardless of where the services are performed. Both of these assumptions are wrong. Let me tell you why. Healthcare pricing is a give and take process between providers and carriers. Hospitals will contractually set a lower price on one service in exchange for a higher reimbursement on another. So the price for the same service in the same network under the same plan can vary by hundreds or even thousands of dollars. Even more surprising is this. Data is telling us that the lower cost providers, facilities, and services tend to be the higher quality providers, facilities, and services. Let me say this one more time. In healthcare, we are finding the less expensive option tends to be the better. How can that be true? Well, healthcare reform has given rise to freestanding medical facilities for outpatient procedures such as MRIs and other diagnostic services. These facilities specialize in one thing, perfecting their methods and finding efficiencies. And they have fewer expenses than larger medical facilities. Throw in the digitization of patient medical records, giving any provider access to your medical history, and it all adds up to better care, better outcomes, and lower prices. This is why the same surgeon can perform the same procedure at two hospitals, but it may cost $34,000 at one and $19,000 at another. So what can you do to maximize your outcomes and ensure you aren't overpaying for healthcare? First, start shopping around for healthcare services. The sooner you start shopping around for healthcare services, the sooner you can start saving. And when you're on a consumer-driven health plan, also known as a CDHP, the annual out-of-pocket savings can add up to hundreds, even thousands of dollars. What if your physician put in an order for an MRI at a high-cost facility? Physicians often stay within their system because they are required to, but it may not be the best choice for you. So it's okay to ask, is there any reason you chose this facility? Do you mind if I look into another option? You're not obligated to that referral and can request a different facility. It's your money and your health. Third, check out your options. How do you find the best facility? There are price transparency tools that can help, and your carrier's website is often an excellent source for comparison shopping. It's all part of an effort to get you to the right provider, in the right place, at the right cost. 5 years ago, we wouldn't even be having this conversation. But legislation, technology, and market realities have changed the way we shop for healthcare. You do your homework before you make important purchases, like cars, electronics, even vacuum cleaners. Doesn't your health deserve the same consideration?